It's called an AV no re-entry tachycardia. SVT is not that difficult to distinguish. You go, oh, it's very fast, very regular. You have a heart rate of 200 and it's completely regular. It's probably SVT. Just call it SVT. Okay? So here we have examples of PACs. Now a PAC comes from the atrium. So we have a normal rhythm. We have our P wave. See, there's a P wave. 1 to 1. P, QRS, P, QRS, P, QRS. Whoop, what happened? Okay, there's a P, but the P wave came in way earlier. It looks a little different than those. But you have a QRS following it, which looks exactly the same as the others. Unlike PVCs, which you'll see in a minute, with a PAC, your QRS, that tall complex you see, is going to be the same. Because it's an atrial phenomenon, so it's going to affect the way the P waves look. So you may or may not see a P wave. Sometimes you don't see a P wave. Most of the time you see a little funky P wave that is coming, way earlier than expected. And afterwards, you have sort of a pause because the heart resets itself to kind of stay in rhythm. Okay? That's where the irregularity comes from when you take somebody's pulse, or when people say, oh, my heart just skipped a beat, or I feel like my heart stopped. But what the brain perceives as my heart just skipped a beat is actually that they don't feel this early beat, but they perceive that pause. Okay? So here's some other examples down here. There's a PAC there. Okay. So you can't really see a P wave, but the QRSs are pretty much the same. Looks a tad bit different, but nothing to speak of. Okay? So, this is, remember what I said in the beginning, first impression? When you first glance at this, even you guys already know there's something not right with this occasion, right? Looks very different than the normal nice one we had a few slides back. So, this is where we're going to start going down our roadmap. Okay, first impression, whoa, this looks a little weird. Okay, now, is it fast or is it slow? What does it look like? It looks fast. Does it look regular or irregular? It's easy to do this on paper if you're not sure, but you can take either calipers or the edge of a paper and mark two of these tall markings, mark two QRSs on your edge and then move them around. Okay. It's irregular. It's fast and it's irregular. Do we see P waves? Okay. So what do you think this is? No P waves. Irregularly irregular. It's like all over the place. So the one thing it can be. Exactly. It's atrial fibrillation. And it's pretty fast. Heart rate of 161. That's the classic thing you'll see, especially if you work in emergency room, okay? Or even, orthopedic floor after surgery, all of a sudden, oh my God, this patient's heart is very fast, it's very irregular. Get an EKG, you probably see something like that, okay? Irregular, no P waves. And typically fast. Atrial fibrillation. Okay? What do you think this is? First impression, does it look normal? No. Okay, now I'm going to step back. I don't think it's normal, but now I've got to figure out what's going on. Same questions you're going to ask yourself with every single EKG. Is it fast? Is it slow?
Fast.
Is it regular or irregular? Do we have P waves? I see a lot of head shaking. So what do you think this is? I'm sorry? Exactly. Oh, you already know how to read EKGs. I don't know what I'm doing here. Okay, yeah. AFib. Okay. You will see this a lot. It is very common. About 3% of the population is in AFib at any one point in time. Okay. What is this? It's a little bit more tricky. First impression, oh, difficult to see without having a way to measure it out, okay? I can tell you that it's irregular. Do we have P waves? Can you discern a P wave in front of every QRS? We can say there, P waves everywhere. No? What do you think this is?
So it's a
It's AFib. You don't see P waves. Yes. Now, it's easy to know, it's easier to figure out if you know the patient has a history of AFib. But this is slow AFib, so this is somebody who's on medications chronically. They're just in AFib all the time. So when you receive a patient on the floor, you may, their baseline EKG may be this, and you may say, you have a history of atrial fibrillation. Okay. You see them on cardizem or beta blocker. All right? So this is a little bit tougher to see on here, but if you had it in front of you, you could actually measure it out. You see that it's irregular. Now, what's this? Okay. First impression, whoa, weird looking. Something not right. Is it fast? Is it slow? Slow. It's like, well, fast and slow, okay? Is it regular or irregular? It's very irregular. Do we have P waves? No P waves? What if I tell you there is a whole bunch of P waves? There's more than you can count. Actually, you can count them. Lots and lots of P waves. Far more P waves than POSs. This is a very textbook, classic picture of atrial flutter. See, that looks like a saw. See that? That edge of I don't know what those saws are called. Okay. That's a classic pattern for atrial flutter. Okay. We just had one yesterday. It's like on the treadmill, somebody went into atrial flutter. Yes?
What's 2-to-1 conduction?
2-to-1 is where you have every other beat gets conducted. And it has a certain look to it. You will see it quite frequently, but it's it can be a little tricky to learn. So I figured it's better to something that you can learn later after you feel more comfortable with EKG. But there's certain clues to how to recognize 2-to-1 flutter. If your heart rate is 150, you want to stay 2-to-1 flutter. And 8 times out of 10 it is. Okay. So this is flutter. What the difference is between flutter and fib, this is that kindergartner, the one kindergartner that has ADHD. All these P waves is that kindergartner that's just bouncing up and down, he's bouncing. Okay, that P wave is as regular as clockwork. Okay? What makes it irregular is that the conduction through the AV node, so your ventricular conduction, is irregular. So the AV node does not let every one of those P waves through to the bottom. Okay? So they're very distinct P waves in flutter. In fib, they are very indistinct. Even though they are there, we just can't see them because they're fibrillating. They're all over the place and too tiny to really see, and they're tumbling sort of all over the place. Whereas in flutter, you have very distinct P waves. You don't always see it like this when you have this beautiful sawtooth pattern, especially when, I don't know your names though, but when he brought up what's 2-to-1 flutter, where every other, you only see 2 flutter waves if you're lucky, you have to know what to look for.